on the renal facts. Renal facts. Again, questions and answers. Are hyaline casts pathological? Pathologic? The answer is no. Hyaline casts in the general urine examination is not pathologic. They are normal urinary constituents. Normal urinary constituents which are increased with fever or after administration of diuretics. Increased with fever or after or diuretics. Okay, so they are hyaline casts are not pathogenic. Okay, what's the significance of granular casts? Granular significance of granular casts. Granular casts يعني شنو؟ formed by tubular epithelial cells associated with acute tubular necrosis. من يصير acute tubular necrosis؟ اوكي، يصير عندنا الابيثيليال سيلز، epithelial tubular cells شو يصير؟ erode and detach and precipitate as casts. Okay, so this indicate acute tubular necrosis and interstitial damage. Okay, so قلنا الهيالين casts are normal, nothing, بس increase with fever and diuretics. The granular casts indicate acute tubular necrosis or what? Or interstitial damage. What is the significance of RBC casts? RBC casts تشوفها أيضا بالجنرال urine examination، بالجنرال urine examination أو urine analysis، what we call urine analysis. نشوف ال RBC casts. What indicate? They are most often caused by glomerular nephritis. RBC casts يعني mostly caused by glomerulonephritis. Okay, mostly caused by glomerulonephritis, but can also be present with acute interstitial nephritis. Also, it's found with interstitial nephritis, diabetic nephropathy, diabetes. Okay, diabetic nephropathy, renal embolism, and renal vein thrombosis. Renal embolism and renal vein thrombosis. All these give us RBC casts. Okay, what is the significance of white BC casts? What indicate? White BC casts most often caused by pyelonephritis. Pyelonephritis. Okay, most often by pyelonephritis, but it can also present in acute glomerulonephritis and acute glomerulonephritis. Okay, these are white BC casts. So we have 4 types of casts. 4 types: hyaline casts, granular casts, RBC casts, and white BC casts. Okay, what can cause false negative nitrate reading on dipstick? نريد نقرأ النيتريت on dipstick false negative. False, cause of false negative nitrate on dipstick. What could be the cause? Non-nitrate reducing organism, large vitamin C sometimes, or urobilinogen sometimes. So non-nitrate reducing organism, non-nitrate reducing organisms are the cause of false negative nitrate dipstick. Okay, what are the possible non-renal causes of elevated serum blood urea and blood urea nitrogen? Non-renal causes of elevated nitrogenous substance, blood urea and blood urea nitrogen. These are dehydration, or any catabolic state, okay, high protein diet, catabolic state or hydroprotein diet, hemorrhagic blood, urethrocholic anastomosis, non-renal causes of elevated blood urea nitrogen are what are they? Dehydration, catabolic state, high protein diet, hemorrhagic blood, and urethrocholic anastomosis. Hemorrhage and urethrocholic anastomosis. Okay, what does azotemia mean? What does azotemia means? It means increase blood urea and nitrogenous substance and waste products in blood. Waste products. This is what we call azotemia. Okay. What does oliguria mean? What does oliguria mean? What does oliguria mean? It means urine excretion less than شنو 0.5 ml per kg per hour. This is, if less, this is what? This is oliguria. This is oliguria. Less than 0.5 ml per kg per hour. Okay? يعني less than 500 ml per 24 hour. 24 hour. What does the term acute renal failure indicate about urine output? Acute renal failure. What does it indicate? About what? About the urine output. It indicates nothing regarding the urine output because it is possible to have oliguric or non-oliguric renal failure. We have oliguric and non-oliguric renal failure. فلا يعني شيء شنو اليورين اوتبوت بالاكيوت renal failure. Okay? Which type has the better prognosis, oliguric or non-oliguric? Which is better? Non-oliguric renal failure has better prognosis. Better prognosis. Okay? What is meant by anuria? Anuria. What's meant by anuria? It means urine excretion less than 100 ml per 24 hour. Less than 100 ml per 24 hour. قلنا اوليغوريا 500 ال100 شنو انيوريا يعني ماكو شيء اصلا. What's believed to be the cause of non-oliguric or polyuric acute renal failure? Causes of non-oliguric acute renal failure. What are they? The causes. Okay? A preservation of some glomerular filtration rate in the presence of tubular dysfunction. Okay? What is believed to be the cause of non-oliguric or polyuric renal acute renal failure يعني شنو يعني معناها preservation of glomerular filtration rate in the presence of tubular dysfunction. هذا يعني انه شنو ليش يصير نون اوليجوريك؟ يعني the glomerular filtration rate preserved شنو على الرغم من tubular وياها tubular dysfunction. هل يصير عندنا نون اوليجوريك renal failure. اوكي؟ What causes diuresis? What causes diuresis phenomena during recovery from acute renal failure? What causes diuresis during recovery from acute renal failure? What causes diuresis phenomena? high filtered urea concentration cause osmotic diuresis. اولا osmotic بسبب اليوريا طالعه osmotic diuresis. ثانيا tubular insensitivity to aldosterone and antidiuretic hormone. tubular insensitivity to aldosterone and antidiuretic hormone. وثالثا loss of medullary concentration gradient. loss of medullary concentration gradient. Okay. How we compare urea clearance with creatinine clearance. urea clearance with creatinine clearance. Okay. Urea is approximately 2/3 creatinine clearance. Urea clearance approximately 2/3 creatinine clearance. Okay. Therefore, blood urea nitrogen rise before creatinine and fall after creatinine during the onset of resolution. Like urea increase before creatinine increment and decrease later before creatinine. Okay. Serum creatinine is an indirect measure of what renal process? Serum creatinine is directly measure what? Glomerular filtration. This is the most important. Okay. How quickly does serum creatinine rise following onset of acute renal failure? تقريبا السيرم creatinine increase 1 milligram per deciliter per day. 1 milligram per deciliter per day increment of serum creatinine. It depends on the rate of production. What significance does increase have for drug dosing in acute renal failure? Serum creatinine cannot use accurately to estimate dose adjustment until a new steady state has been reached. So, serum creatinine cannot adjust or cannot use to adjust doses in acute renal failure. What are 3 classic forms of acute renal failure? Classic form of acute renal failure: pre-renal, renal, and post-renal. Okay. Name the most common pre-renal causes. All of these pre-renal causes pre-renal causes شنو؟ عندنا kidney hypoperfusion, shock, dehydration, burn, some drugs, renal artery problems, hypovolemia, drugs, etc. Most common post-renal يعني mechanical obstructions. Post-renal causes usually in the pelvis, ureter, could be bladder, prostate, urethra, and so on. This is post-renal causes. Okay? Especially bilateral, unless the patient has one kidney and the same side of obstruction. Otherwise, the bilateral problem cause post-renal acute renal failure.